Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is what you need to know about occipital nerve blocks. An occipital nerve block is an injection of numbing medicine next to, you guessed it, the occipital nerves. They are located on either side of the scalp, originating from the neck region. There's a greater and a lesser occipital nerve. Either one can cause pain, but neither has a motor or function. It's only sensory. The injection is designed to stop the pain traveling along these nerves, which can lead to occipital neuralgia, cervicogenic headaches, or migraines. The injection itself serves both a diagnostic and a therapeutic purpose. The symptoms of occipital neuralgia include pain in one or both sides of the head, tenderness at the scalp, aching, burning, throbbing type of pain, and it can be described as a sharp or electrical shock in the back part of the neck and the head. Well, who benefits from an occipital nerve block? Well, occipital neuralgia, those with pain on one side of the back of the head, benefit the most. Those suffering from migraines. Cervicogenic headaches, by definition, is any headache caused by a neck problem, and typically it's one-sided. Cluster headache is one of the most painful headache types. Those can benefit as well. An occipital block is a quick procedure. It can be done in the office in just a few minutes. There's no need for sedation. The pain doctor will feel the point of maximum tenderness at the base of the skull and then move the needle to inject both nerve areas, greater and lesser occipital, with numbing medicine and possibly some steroid medicine as well. How well does the procedure work? Well, for such a quick, low-risk procedure, it works amazingly well. Most patients get pain relief within just a few minutes. For cervicogenic headaches, studies have shown a 50 to 90% response rate. For cluster headaches, an 85% response rate, which lasted 4 weeks to 4 months. And occipital neuralgia, 85% response rate for 1 to 2 months. Migraines, 60% response rate, averaging 4 to 5 weeks. When the pain relief wears off after the occipital neuralgia, what's next? Well, repeating the procedure works very well. Okay, so that can be done in the office, as mentioned, in just a couple minutes. Pulsed or regular radio frequency ablation is a great procedure. Basically, you put the needle into the same area where you're going to do the greater or lesser occipital block, and then it heats up and pulses heat around those occipital nerves, and it can sort of deaden them and relieve pain that way. They'll grow back, but remember, they're only sensory, they're not motor, so it's not a big deal. Are there risks? The risks are minimal with this procedure. There may be a risk of some slight bleeding, infection, allergic reaction. The needle is outside the spinal canal, and these nerves are not motor, so there's really no risk of a spinal cord injury or CSF leak. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.